Pleased to be with you again. The community of health and design is so vibrant and so wonderful and filled with amazing people, and you're one of them. So it's an honor to be here, speaking with you, with all of you. I wanted to tell you about a conference that I'm putting on in Atlanta, actually. Atlanta is quite the hot spot for design and innovation in health. June 3rd and 4th at Emory University. It's if you go to designfordignity.com, you can find out about the event. It's overlap of health and social impact with a focus on experience innovation, design, and futures thinking. And we'd love to see you there. So I'll dive right in. I have a lot of thinking that I've put together that represents learning experiences and curiosity for the past 25 years, where I've been working at the intersection of health and design. I'm passionate about improving health experiences. It's a place where you can really use your skills and experience, figure out how to adapt to technology, how to evolve organizations to better serve people and save lives, which is why we're all here doing the hard work that we're doing in health. So I do believe that now more than ever, especially with everything that's going on in AI, that our role as designers is going to call for us to have a greater focus on ethics moving forward, and to preserve a sense of dignity, to look out for when that dignity is not being preserved, and to look for opportunities to go above and beyond to provide people with the dignity they so deserve. So I'm going to dive into that topic today with you, design for dignity. So, what is design? To start with, the design part of designing for dignity. Design is a plan for arranging elements in such a way as to best accomplish a particular purpose. So, I am a designer. I have always been a designer. I always will be a designer. I believe design gives us a lens through which we can imagine a better way. And design paints the picture of what is possible. The focus on purpose in this quote here by Charles Eames is key. What's the outcome we're seeking from the health perspective, from the organizational perspective, from a social perspective, from a personal perspective? What is driving the pursuit of the outcomes we're hoping to achieve? And what experiences are we hoping to manifest? And what principles or process is guiding us to that end? And this is where dignity comes in. I was fortunate enough to care for my amazing mother before she passed away 5 years ago in 2020. And through that time, I was able to experience hospice care. In hospice, everything's designed to add more life to your days as opposed to adding more days to your life. So, hospice workers encourage you to focus on meaning and relationship and to find joy in and through a very difficult situation. Each individual hospice worker had empathy, but the system itself of hospice care was designed to provide human support during an extremely difficult time. And that enabled the humans in the system to actually bring their best to the situation. When we're suffering or caring for those who are suffering, we feel vulnerable, and dignity comes into focus, especially in situations like that. And this experience in particular started me along the path of thinking deeply about dignity and how dignity extends to all people and our entire human experience. So, what is dignity? Dignity comes from the Latin dignitas, meaning worth, worthiness, and is the right of a person to be valued and respected for their own sake and to be treated ethically. And in health, we know that clinicians take the Hippocratic Oath, which expresses their ethical commitment to doing no harm and ensuring dignity. Whether we're a clinician or we're a technologist in innovation, in design, in research, in program management, administration, operations, I believe that everyone in the health system can aspire to the same commitment. Experiences of indignity and dignity can be really easy to spot. We may have experienced these moments, these feelings ourselves, or seen another experiencing them through our research or through the work we have providing care. So, someone in an indignified experience, somebody might feel excluded as opposed to included, harmed as opposed to supported, devalued as opposed to valued, judged or shamed as opposed to respected, locked out as opposed to invited, ignored instead of engaged, mistrusted as opposed to trusted, belittled as opposed to encouraged, controlled as opposed to empowered, brushed off as opposed to accompanied, shamed as opposed to forgiven, and marginalized as opposed to elevated. So we can look out for moments where we can provide greater dignity, or for moments where people are feeling treated badly and are experiencing these moments of indignity so that we can correct them. So I've always believed that cognitive empathy, which is understanding the situation of another, and emotional empathy, which is feeling for another, are essential to the practice of human-centered design. And we all know this. I've heard compassion actually described as empathy in action, the act of simply being present, or said differently, breathing with another person. So this presence to me is the embodiment of respect for another person and the moment itself. And it's the guiding principle of respecting the wisdom of the lived experiences of our fellow humans. And part of this is really understanding the with them part. To me, that calls out the notion of co-creation and participatory design, to design with people as opposed to for them. And this can inspire us to ensure dignity. But, I'm sure we've seen empathy talked about a lot, and cookie cutter approaches to um, implementing empathy or affecting empathy. And I started to wonder, is empathy enough to help us deliver the best possible human experiences? Can we teach it? How do we codify it? Can we measure it or its impact? And how do we ensure that it fully inspires the experiences that we deliver, the processes that we adopt, the policies that we enact? So I believe that a focus on moral philosophy, ethics, and human dignity can change the conversation and guide us towards principles that can help us define our purpose and manifest it. It's really about those guideposts. So, does the next evolution in design and in AI call us to be ethicists? I think it does. Moral philosophy and ethics provide a way for individuals and organizations to infuse empathy into the system. So, from a systems thinking lens, there are so many pieces and parts in the health ecosystem. We need to look out for opportunities to infuse this kind of thinking and to evaluate experiences based on this kind of thinking. Uh, the focus on moral philosophy and principles can help us to address dehumanization, protect human rights, reduce harm, codify respect, elevate experiences, and design for positive impact. And there's a lot more lenses through which we can explore the concept of dignity, including the economic aspects, the spiritual aspects, the psychological aspects. I'm a huge fan of exploring all of those lenses, and I collect frameworks. I'm a little bit of a framework nut. And so I'd love to share some of these frameworks with you here today. But some of you might be thinking or may have heard in your quest to make a positive impact in health, what about business? So I love this quote from Charles Dickens in A Christmas Carol when Scrooge says, as he's learning about how he could have done better. Uh, Mankind was my business. The common welfare was my business. Charity, mercy, forbearance, and benevolence were all my business. The dealings of my trade were but a drop of water in the comprehensive ocean of my business. So I believe that we should attempt to evolve business and our roles within them to the greatest extent possible to focus on positive human outcomes. And this is going to create a virtuous circle where we're serving people better, and that will bolster satisfaction, loyalty, advocacy, and create a positive loop that lifts everyone. These notions are sometimes referred to as conscious capitalism and things like that. But to do well in business by doing good and doing right by folks. Kant pointed out in 1785 that people are not mere objects in a capitalist system. He said, in the realm of the ends, everything has either a price or a dignity. Something that has a price can be exchanged for something else of equal value, whereas that which exceeds all price and therefore admits of no equivalent has a dignity. And like I mentioned, conscious capitalism, there's also corporate social responsibility, triple P bottom line, shared value creation. All of these constructs come into play. And this asks us to consider, who are we responsible to? What are we responsible for? What truly are the outcomes that we're seeking? And this is of particular importance as we consider where AI could take us. Where are we trying to go? What is positive? How would we measure it? How do we point in that positive direction? And it extends beyond typical fiduciary responsibility associated with organizations and gets into economy for the common good and also donut economics. So, Donut Economics is a fantastic book by Kat Rayworth, and this visual here explains donut economics, where we're looking to provision for human flourishing at the center, all of these things that humans need to flourish without overshooting the natural bounds of our ecosystem, our home planet. And this is important as well as we consider our measures of success and where we're pointing to and what good looks like. I believe that people are not externalities. So it can be difficult to shift our focus, but considering the social contract that your organization has with the people you serve, both inside and outside of your organization, that can be a great start. What do they expect of you? What does success look like in their eyes? And what are the things that you're not measuring that should be measured? So, for example, does an insurance company measure how many of its members have to file medical bankruptcy or can't afford their medical bills? Do they make it their business to understand that? Or a hospital, if people are avoiding care due to cost, what is their role in that? And how can the multiple parts of the health ecosystem stitch together to address complicated issues like food food insecurity and how we need food to live, and we won't be able to manage our health and become healthier without access to that food that we need. So these are just some considerations of going outside the common bounds of our business models to truly serve people better. And the part about internal versus external, I mean, if a caregiver, if a doctor, a nurse, a clinician is stressed and burnt out, they're carrying that into the interaction with the patient. It's going to affect the patient experience. If the patient has had a bad experience, trying to find a parking spot, wayfinding through the hospital, they're late for their appointment. They're bringing that stress and that circumstance and even past medical trauma that they've had into the experience with the clinician, and that's going to impact them as well. And then from a systems perspective, if the way things are set up doesn't provide enough time or information for quality connection, relationship, and problem solving and shared decision making, that's going to have a detrimental impact on all of the folks involved. So this is how everything is knit together in that systems fabric. I believe that design without inclusion is injustice. So looking after fair outcomes so that we are indeed helping all people become healthier. And, you know, we can design so as not to lock anyone out of an experience, to ensure equity and to address bias. And again, this means to design with people, not just for people. So engaging in participatory design, participatory decision making, like participatory budgeting, even to help people who are affected by the decisions made in the process of making decisions. These approaches can help us to include and respect those that will be affected so that we can design not just for access, but also human thriving. Shifting to a governance lens, the UN declared the importance of dignity and human rights post World War II in a Declaration of Human Rights that said all human beings are born free and equal in dignity and rights. They're endowed with reason and conscience and should act towards one another in the spirit of brotherhood. And there's a humanist lens looking at psychology. The Humanist magazine defines humanism as a rational philosophy informed by science, inspired by art, and motivated by compassion, affirming the dignity of each human being. It supports the maximization of individual liberty and opportunity consonant with social and planetary responsibility. And of course, all of us in design are familiar with Maslow's hierarchy of needs, which provides us a view of where to start in terms of harm reduction and positive impact, building from a solid foundation. Further on, psychology, self-determination theory, which is part of positive psychology, says that autonomy, competence, and relatedness are core to human motivation. So if through the experience we are damaging people's autonomy, taking away their control, or making something so difficult that they feel incompetent, or making it so that they feel isolated, they don't have the support they need, all of these things can cause somebody to become disengaged and have a detrimental impact on their motivation, which can, of course, affect their health in the moment and long term. We all know intuitively that well-being is the foundation for health, and we need to focus on the whole person. So what you see here on the right is the wellness wheel. It's a view of the aspects that are interconnected that make up the wellness of us human beings. And each one affects the other. If you have environmental, if you are living if you're an asthmatic living in an urban environment with high pollution rates, it's going to have an impact on your physical health. If you are socially isolated, it's going to have an impact on your emotional health. So all of these things are interconnected. And my mother put it well when she said, in speaking about one of the doctors who had treated her, the doctor treated me like a whole person, not just a body, but someone with a heart and a soul. So we know that life affects health and health affects life. So life affects health, for example, when a caregiver, for example, experiences stress and that increases their likelihood of substance abuse. Or when health affects life, for example, a new diagnosis that turns life upside down, where you have to understand new medications, new treatments, and new diet, new lifestyle behaviors, etc. And I keep talking about systems thinking and taking a systems based approach. And this is because we truly need to consider cause and effect and how people end up where they are intention. I like this quote by Desmond Tutu that is, there comes a point where we need to stop pulling people out of the river and go upstream and find out why they're falling in. We've heard of social determinants or social drivers of health. Um, Certainly, one has the ability to affect their own destiny, but the situations that they're coming across in life, especially early in life, can affect their understanding, their options, even their hope of what might be possible for them. This is a great visual representation of social determinants by GoInvo. And you can actually check it out. It's evidence based and order it if you like. They're an amazing design firm in health. Everything is connected. So, what outcomes are we shooting for? And what actions will impact those outcomes? And how do we measure it so that we are constantly improving? You heard me talk about virtuous circle. Uh, there can be downward spirals where harm continues and gets worse, or there can be positive cycles that uh, can help address things like intergenerational poverty or violence in family dynamics. How can we look at cause and effect in systems so that we're creating circles that uplift? So I've been investigating futures thinking a lot in the past 5 years, practicing futures thinking frameworks in my work and taking master's classes in the topic. And in futures thinking, we think about possible, plausible, and preferable futures. And we look at different scenarios that might occur if two drivers of change were to intersect, if two uncertainties were to intersect. We don't know what's going to happen in the future. There's no data from the future. Uh, so um, in the process of thinking about the future, we can take action today that changes the trajectory of the future. So what you see here are a couple of frameworks. On the left is called a 2x2 um, matrix or 2x2 scenarios where you select drivers for change and you look at the if it's minimal impact or it's maximal impact. This one is about affordable housing and what could happen if communitarianism and housing as a human right were to intersect. We might have designed communities or what the future worlds would be like in these other circumstances. This can help us identify a preferred future so that we can aspire towards it, figuring out the steps to get there, working within the ecosystem. It can also help us identify detrimental futures and seek to avoid those futures, to de risk. On the right, you see cascading impacts. And this is where we look at if this one event were to happen, then what would happen? And if that happened, what would happen? And if that happened, what would happen? So this can help you start to anticipate unintended consequences and look out for opportunities as well. It's really easy to imagine the apocalypse, but it's really hard to imagine a world where things are going well. But there's actually methods to do that. One of them is called rigorous imagining, and it was put forth by Elise Boulding in some research that she did, some project work. And in particular, she asked one group to close their eyes and imagine what a world of peace looks like. From all of the senses, from all of the systems, what is happening? What are humans experiencing? What is the world like? What is life like? And through leveraging our creativity, we can start to surface these worlds and shoot towards them. And this is so we can move from surviving to thriving, to design systems that support human flourishing. I've done some thinking about, specifically how, like, what are the steps we can use to design for dignity? And I think, again, in the spirit of Maslow's hierarchy, starting by identifying and reducing harm, moving into promoting respect, then moving into identifying the goals that people have in their lives and how we might support them, then to inspiring hope and infusing joy. If you infuse joy, well, there's also still harm, that is going to create cognitive dissonance and it's not going to make sense or move the dial. So I believe we need to move in that sort of rank order. So first, harm reduction. How can we stop the harm from situational stress to medical bankruptcy to disproportionately poor outcomes? And this involves taking a trauma-informed stance, looking at systemic equity, and identifying and addressing bias, looking at the negative impact an organization might have, and seeking to reduce it. Also, fear is a harm. So, understanding what do people fear most in their lives, and how do we help them to avoid that fear, from not being able to afford the necessities of life to losing your life to premature death, and wanting to stay as healthy as possible. How do we work with people on that level? In terms of respect, how do we listen more, build trust? There's a lot of talk of trust. And I think as designers, we can design for trust. We can help our organizations actually figure out how to build better relationships built on trust so that we can respond well and foster a culture of humane treatment as opposed to policies that do damage. And I think it's important to put a focus on human connection in the right moments. Um, all this technology that we have in our lives, um, maybe it makes things better in some ways and worse in others. So maybe as designers, we're designing for human connection. Before, we were designing for digital interfaces. Maybe in the future, we're designing for human connection, especially in a world where it's increasingly less and less, or more and more screen-based. Also, goal support. What do people want most in their lives, and how do we help them achieve it? To finding healing of a loved one, to more energy, to better relationships. How do we support these goals? Recently did research in the family impacts of opioid use disorder and did a large-scale quantitative research study and asked people, where did they suffer the most in terms of OUD impacts their families? And what came out was relationships. People said they suffered the most harm in their relationships. And in fact, relationships were what they valued most. And going back to the wellness wheel, if your relationships are disrupted, it's going to disrupt other aspects of your life as well, including your emotional, mental, and physical health. So, what future is possible for people? How can we help people dream? Because they can be limited by their beliefs, the belief that they have around what is possible. So, how do we paint with them a new picture of what's possible and build on opportunities and strengths? What aspirational future could we unlock with them in partnership? And finally, what brings people joy? How do we design for more joy? So, where there is suffering, there also can be joy. And I told you about that hospice experience I had, which was very painful, but there was also joy there. Another example is a children's hospital that helps kids to laugh, to play and explore, understanding that every day a child spends in a hospital is a day they're not spending in their childhood. How do we help infuse uh, childhood joy into a hospital experience? I'd love to share with you, and you're going to have to let me know, Theo, if you're going to be able to hear this, but I'd like to share with you my mother and her patient story. I know we're pressed for time, so I'll actually share a link out at the end here so you can check this out. It's a 5-minute video on YouTube that I'd love to share with you. I know that you'll be inspired because I've heard from so many how inspired they were from this video. So finally, I ask you, especially at the end of this conference where I'm sure you're saturated with fantastic information and inspiration, to consider right now, today, on this day in May 2025, knowing what we know, facing the challenges that lie ahead, what commitment do you want to make? What impact do you want to make? And think about that uh, in terms of your oath. So this is an example of an oath that was designed by Sierra Taylor and Samantha Dempsey while we were all at MadPow. And it basically is a Mad Lib where you can fill in the blanks, but you could also write your own oath and think about your personal commitment, your ethical commitment, and ultimately the impact you'd like to drive in your work. Because if we have a focus on that impact, we'll be able to make bold decisions and bold actions in the direction of that impact. It becomes more about the impact than the day to day. And sometimes it's not so easy to drive impact in our organizations. So it requires, especially if no one's asking us, to focus in that way. It requires us to go above and beyond to focus in that way. So I encourage you to think about that and reflect on that as you move into the weekend of your personal commitment. And you can make an organizational commitment also. This, what you see here, is the Design for Dignity workshop canvas. It is a canvas available to all. You can do a workshop with your team to think about dignity and how you can improve the dignity that you are preserving for the people you serve inside and outside of your organizations. Ben Little and I put this together, and it's on Mural or Miro. I'm forgetting right now, but it's a canvas you can use. So finally, I'd like to leave you with this thought: to go where the love is, and in fact, to be the love. There's so much challenge, and it's difficult to innovate and gain traction in a positive direction, especially in complicated environments. But I think love can point us in the right direction and keep us going. Love drives action. It rearranges our priorities. It leads us to things we didn't know were possible. And that's where the hope is. So it's important to love on our coworkers and love also, though, on ourselves. Making an impact is hard. So it's important to think about how to keep nourishing ourselves, making time for rest, time for reflection, so that we can bring our best lives to our work and the people we love. So that's all I have. Thank you so much